Bone scans. What are they? A bone scan is a type of test that will use nuclear imaging to diagnose and track different types of bone diseases. Since a bone scan is a type of nuclear imaging, this scan involves using small amounts of radiation substances. This is called radioactive tracers. Once the tracers are in the body, a special camera called a gamma camera will detect the radioactivity. Then the results are sent to a computer so you can see the bones in the body. This test helps find issues that doesn't show up on a standard X-ray, like a bone infection or just a regular bone injury. This scan is also used when detecting cancer that has spread to the bone from a tumor's original location. Even though a bone scan uses radioactive tracers for an image, the tracers do not use a lot of radiation. Since the tracers don't use that much radiation, there is little exposure to radiation. A CT scan has more radiation exposure than a bone scan. The radiation tracers will be injected into a vein, either the arm or the hand. After the patient is injected with the tracers, some patients will take the scan right away, but some patients will have to wait 2 to 4 hours before the scan. The reason that a patient usually must wait before the scan, after the injection of the tracers, it is so the tracers can circulate and be absorbed by the bones. Then a patient will be asked to drink a lot of water while they wait. This is so they can empty their bladder before the scan to remove any extra tracers that were not absorbed. Now the patient is ready for an actual scan. They will lay flat on a still table while the gamma camera moves around the patient taking photos. This scan may take up to an hour and is painless. Once the test is over, the patient is good to leave. They are just asked to drink lots of water so they can flush out the remaining tracers from their body. This scan usually doesn't have any side effects and there are no follow-up needed. The results from the scan are ready to read by the radiologist and they look for evidence of bone metabolism. These areas will appear as darker hot spots or lighter cold spots. These are spots where the tracers have not collected. The bone scan was developed in the 1950s by a group of people and not just one person.